there, good morning. Sorry about the light, but that's how the sun's hitting the window this morning. And I want to be able to show you guys some yoga positions since this morning's topic is going to be about yoga and the pelvis. So ask me your questions. This conversation is appropriate for a yoga teacher, obviously, if you want to just go over a little anatomy, biomechanics, and emotional stuff of the pelvis. And also if you're students, so you can learn a little bit more about your body and how the poses might fit your body a little bit better, as well as if you're a physical therapist or a healthcare practitioner. Yoga is such a blossoming field these days that I know a lot of healthcare providers that have yoga students that come to them wanting to get back to their yoga classes. So even if you just want to learn a little bit more about some of the popular poses in yoga, so to speak, and how it can affect the spine and the pelvis, then this conversation's for you. So again, if any questions come up, just comment them below. We are going to talk about how the pelvis affects the spine, and I get a lot of questions while I'm teaching and after I'm teaching about what the pelvis should be doing in certain yoga poses and why. Why is that, right? So let's take a look at the spine for a second. Sorry about this light here. Okay, so here's my handy spine, right? So the spine should have 3 natural curves. Mine does not, because as you can see, there's a dysfunction going on. My daughter pulled the skull off the spine. She literally pulled its head off. And my husband drilled it back on and smushed it down. So it's a lot like a lot of us that sit on the computer and we lose our cervical lordosis or a curve. This cervical or neck area is pretty flat and has lost its space. So it actually is a representation of a lot of society right now. But the thoracic spine should have a gentle kyphosis or a little bit of rounding. The lumbar spine, a little bit of a lordosis. And the pelvis sits with a little bit, very, very slight anterior pelvic tilt. So what happens with yoga a lot of the time, I think there's a confusion of people being fearful of going into too much of a back bend or lordosis through some of the poses. So then they overcompensate and come into a posterior tilt, which flattens. As you can see, you lose that lumbar curve when you tuck the tail. So what the heck am I talking about? So the pelvis here, right? It sits in a slight anterior pelvic tilt, and we should have the ability to posteriorly tilt or tuck our tail in between our legs like an angry or sad dog, or you have the ability to roll and tilt the pelvis forward as if, you know, it were a bowl full of water and you were going to spill that out. So that happens in, you know, every day as we move, the pelvis is shifting forward and back, which affects the spine, right? So it's like a little dance. We're going forward and back. But this also plays into effect when we're doing our yoga postures, right? And so there's a couple of things that happen is that there should be a sacral or a pelvis and spinal rhythm. When the pelvis does one thing, the spine kind of follows and does another. It's called, some places call it a couple motion. There's actually some controversy on this in the physical therapy and the yoga world. So, you know, for me, I'm finding it's best to be in tune with the body and come back to foundation. So ideally what the purpose of the pose is, whether you're doing it yourself or if you're a physical therapist or yoga teacher and working one-on-one, what's the purpose of having a student or a class do the pose? Like, what do you want to achieve in the body and even in the mind? Because in the pelvis, you know, the sacrum's in the back here. There's the sacral plexus, which is also associated with, you know, the fight or flight response or the ability to relax and calm the nervous system. And in some schools of thoughts, the first chakra sits right there in the pelvis, which is associated with our ability to feel safe and supported and grounded, or if we're always tense and trying to control our environment because we don't trust what's going on. So comment below if you have any thoughts about this. Here's a sneak preview question. In downward dog, do you think the pelvis should be an anterior pelvic tilt or posterior, and why? And if you're watching this on replay, you know, don't sneak a peek at the comments above, just type replay and write in your answer and why you think that is, and we'll have a discussion, okay? While you're thinking about this, I'm gonna talk about some oils that help to support the nervous system and the mind. So if there's any gripping through the pelvis, especially, you know, the psoas is there, so when we're stressed and tensed and we want to take flight, or our boss yells at us and we're getting in a fight with our significant other and the psoas wants to grip, it's in the front of the pelvis. Most of you, I know this, attaches on the spine, dives down, and attaches on the femur, or inserts on the femur. So that can pull the lumbar spine in too much of a lordosis. It can tilt the pelvis into too much of an anterior pelvic tilt. And also it can just lock down the pelvis so it doesn't move as freely. So a lot of times when I'm feeling stressed or tense, or I don't feel completely supported for whatever reason, you can go through a major colon surgery, for example, or life-changing diagnosis, and for me, I just had to use a little external support to help calm down my nervous system. So there's a few essential oils that are really, really great for this. Vetiver and cedarwood are not my two favorite smelling oils. Actually, I really, really don't like how they smell. However, just like in yoga or in physical therapy, the things that we don't like are often the things that we need. They're very, very grounding. I use these before bed, so they help to calm the nervous system, and so you can sleep better. So they're very relaxing. Vetiver, I have a little dropper top because it's so thick. This is how you know a good vetiver, like from Young Living, or a vetiver that is not so good, like from Sprouts or something. You can actually test the bottles, but it should be like maple syrup or honey, like super viscous. So it's, if you can see that, it's not gonna just drop easily out of the dropper top. So I have this special dropper top that I just keep on the bottle, so I can either drop a drop into my palm and inhale it in, or I can put it right in the diffuser and keep it next to my bed to help me sleep through the night. Another one that's really a really good oil blend that's really great in helping support the pelvis is and the emotional system is abundance. And as I mentioned before, the first chakra is associated with the feeling of support, and sometimes that means financial support. It can mean just emotional support from those that we care about, things like that. And so abundance doesn't always mean money, but it can. And that blend smells amazing. It has cinnamon and myrrh in it, and it just helps to support your nervous system in a way that you feel not by yourself, that you're not isolated, and that the universe in a way is there to help guide you, and so you can trust everything a little bit more. And the last oil is grounding. Obviously does what it says, so helps to is really great to put a drop in the palm or on the wrist before meditating or going into restorative postures. So again, helps to calm the nervous system or support the nervous system, so you can just get more enhanced effects with whatever you're trying to do. Okay, so that's more of the emotional or mental side. And again, if you feel a lot of gripping through the pelvis, or feel like you can't move. So a really great way to determine if the pelvis is locked up is in the physical therapy world. There's something called the pelvic clock, which you can lie on your back, and it's best to be done this with a healthcare provider the first time, because it's a little bit hard to move through the motions, and sometimes that brain to muscle activation is not always there because we haven't moved the pelvis in a certain way ever, maybe, or not in a long time. So you need someone to help manually guide you into certain positions. But essentially you move your pelvis through the numbers of a clock, just to help. It creates a really great awareness of what positions are easy to move in and what positions do you avoid, and why, because something might come onto your radar like pain or discomfort, that sort of thing. But in a yoga class, you know, this is Southern California, so everyone pretty much is familiar with the cat and camel or cat and cow pose, where you move the pelvis into anterior or posterior pelvic tilt. And it's a great way for students to explore which direction they have a preferred way to move and which direction they like to avoid, and again, why it may cause symptoms if they go into extension in the spine. Because, as again I said, when the pelvis moves one way, it's not just done in isolation by itself. So the pelvis doesn't tip forward and the spine stays stable. When the pelvis tips forward, the spine will automatically drift into extension, and the reverse is true. You can see when the pelvis moves into posterior tilt, the spine moves into flexion. So in terms of yoga, you know, it's important to think of this as we move into a lot of the postures. So for example, down dog, I asked you guys, what position do you think the pelvis should be in? And I think for a lot of the students, they don't even know that the pelvis can move in down dog. So I'll show you what usually happens. I see a lot of the newbies, right? So their hamstrings are really tight, the back of the legs. And just make sure you guys can see me. If you can't see me, just comment below and I'll do a redo. But a lot of times the students, you know, they'll start from all fours, and they'll, because of tight hamstrings, the pelvis stays rounded and they come into downward dog, and the spine, the lumbar spine especially, has this curved shape. So it's a reverse, it's not a reversal of this lumbar curve. Normally when we come into down dog, the lumbar spine should come into a little bit of a lordosis. And if you think back, right, so how do we achieve lumbar lordosis? Not only just through the spine, is through the pelvis, by getting the pelvis to move into anterior pelvic tilt, right? Then the spine comes into anterior pelvic tilt. If anyone was watching, were you able to see the down dog okay? Like, because I'm an amateur video, and I don't really have this, I don't have a professional camera stand. So if someone can comment below and just let me know that they saw the down dog okay, then I'll demo again. You know, normally in down dog, what should happen is that the spine should roll into a little bit of an anterior pelvic tilt. So sometimes you hear the comment of, you know, lift your sit bones towards the ceiling, or tip the pelvis forward, all that kind of stuff. And that is to help achieve that natural lordosis of the lumbar spine. Now, why do we want that, right? So A, the spine comes back to its normal curves, but also B, if the students stay in that flexed lumbar spine, it really puts a lot of pressure on the discs. And, you know, most of you know what's the common pain that everyone's taking off of work from or getting locked up from, all this sorts of things. It's a low back pain, right? So any way we can reduce or prevent low back pain, especially in yoga classes when students come there for relief, that's the better, right? So one huge thing is helping students guide their pelvis into anterior pelvic tilt, either through verbal cueing, breaking down the pose, or just manually guiding them there. But it's a huge difference of the pelvis being in posterior pelvic tilt and anterior. So I'll show you. So you can, again, right, so here's posterior tilt. The spine stays rounded, the heels have a hard time coming to the floor. Or you can come into anterior pelvic tilt and keep the sit bones lifted, and the spine comes into its natural curve, stomach's engaged to prevent too much collapsing, especially through the shoulders, and then the heels can come to the ground. So huge difference of this versus this. And you know, a lot of students just don't get that motion. They just don't know how to move their pelvis in that way. So as yoga teachers and physical therapists, especially if we're on a one-on-one setting, this is something we can do to really help facilitate that movement and take a lot of pressure off the discs and nerves. And then it's going to also open this whole pelvis region, but sometimes the whole thing kind of gets clamped down and hypertonic. There's a lot of gripping through there. So, you know, again, it softens this whole region, and it calms the nervous system, so taking them out of that fight or flight response. So it has this snowball effect from nervous system to physical, and physical back to the nervous system. So essentially, you know, in life, they're either going to have more resiliency, so the better ability to heal from injury or prevent injury, or if injury does happen, it's not going to escalate so high. They're going to feel they're supported. They have better tools to handle whatever comes. Also, that's the same, you know, the same is true with anything that comes on. You know, it's not going to be such these highs and lows, peaks and valleys of riding this roller coaster of life, because it's not always smooth sailing. We all know this, right? So the more flexibility and strength we have, so mobility, not just with our muscles, right? So again, what can help that anterior pelvic tilt in down dog? This is just one example. You know, comment below, like, what muscle group would be limiting the pelvis to move into anterior pelvic tilt? So if you know that answer, comment below. I already mentioned it, but I'll keep you guys in suspense and maybe write it in later, so stay tuned. But you know, that major group also plays into low back pain, especially disc stuff. I see a lot in my clinic. So this is just a few examples. I'm going to check out the time of how, you know, the pelvis can be brought into yoga. And I mean, the poses where the pelvis, you know, moves or doesn't move in yoga is endless. So this can be taken to any seated posture. So then staff pose, dandasana, what position the pelvis should be in. And again, what muscle group limits this? Janu Shirshasana, what's happening there? Okay, here's a tricky one, back bends. What happens with the pelvis here? Here's the great controversial thing happening in the yoga world right now. Should the pelvis be an anterior or posterior tilt when you back bend? You know, my philosophy is person first. So I'm looking at the person in front of me and their spine. Are they in too much reduced lumbar curve? Is it too excessive? Is it just right? What am I going to try to achieve in that back bend? If I'm trying to promote more lordosis or extension through the spine, I'm going to want the pelvis to anteriorly tilt, right? Which is really counterintuitive, because that tucking of the tail and back bends cueing is still going on. And maybe that's appropriate for someone, right? If they're already in too much extension and they have no idea how to use their abs or their glutes, they might need to tuck the tail a little bit in a back bend. But I think for a lot of people, we're in this couch, slouch, rounded position where the spine is kind of stuck in a reduced lumbar curve, and that same muscle group is really restricted, and so they actually need to go into an anterior pelvic tilt to help promote that lumbar extension. On the other hand, on the other side of the pelvis, the psoas, if you go into too much anterior pelvic tilt, then we're not allowing the quadriceps and the psoas tendons to lengthen as well, right? So there is a balance of, allowing the hip to extend as the spine comes into a back bend. So just think about all that. So as a yoga teacher, or if you're a PT, because I see some PTs on here, I see some yoga teachers on here, how do you cue in back bends with the pelvis? Do you prefer to stay in neutral, just having them engage the core? That's what a lot of the times I do in class, just because, I don't have the luxury of analyzing each person in that moment. So a lot of times I just have them engage the core and fire their glutes. They need to fire their glutes in a back bend. Or do you help guide them into anterior pelvic tilt in a back bend? Or do you do the tucking of the tail? I mean, I think, again, they all have their place and time, and as long as you can logically reason why you're giving a cue the way you give a cue, then it's valid. It's just when we blindly throw out cues as yoga teachers or healthcare providers teaching yoga, because our teacher before us said that cue, or we learned it in a training, right, and we're just blindly throwing out cues, that's when I think we run into problems. So again, I can go into a lot more detail, obviously, on a lot more specific yoga poses, even using the yoga wall and positioning of the pelvis. But I'm kind of running short on time, and my phone's gonna die. I always know I'm running short on time because my low battery sign comes up. But so if you want to talk a little bit more about this topic, please comment below, and I'll continue this on. Or if you have a suggestion for next week, I'm really open to it. So again, comment below. I'm doing these Facebook Lives, for you guys to start a community here so we can exchange ideas and stay up to date. I don't know everything. I'm learning every day, just the same as you guys. So if I say something that's maybe not correct or maybe not up to date, let's, help me to learn as well. So please comment, hashtag, and we'll stay connected. So share your ideas, that what you want to talk about for next week, whether it's healing from injury, preventing injury, a specific body part, a specific yoga pose. It's pretty endless. I love all this kind of stuff. Oils, of course. I always try to just sprinkle them in. So thanks for all of you that tuned in, and I'll see you next week, Wednesday at 9. Okay, bye.